My name is Rashmi Halker Singh. I'm the Deputy Editor of Headache. I am joined today by one of the authors of a recent publication called Daith Piercing, Revisited from the Perspective of Auricular Acupuncture Systems, a Narrative Review, Dr. Saroj Pradhan. Welcome. I'm so happy to have you here with me today.
Thank you. Thank you for the opportunity.
So this is a really interesting manuscript and something comes up in our clinical practice all the time. But I was just curious from your perspective, what prompted you to study daith piercing?
Well, that's an interesting question. Migraine is quite complex. It's a neurological disorder, and we are working at a rehabilitation center, and we have a multimodal pain management program, which is designed for medication overuse headache patients and chronic migraine patients. And over the years, we observed several patients who were suffering from headaches. They used to have a piercing on the crus of the helix. And I just got curious because in Chinese medicine, we have the auricular system and you have the Chinese auricular acupuncture, right? And I used to ask them, why do you have this piercing? And they used to answer, yeah, because I thought someone told me this might help. And like someone did it and it helped a little bit. And I did it too. And I got very curious about this. So, and every week on Friday, we have a meeting with all the doctors, physicians, with the neuropsychologists and massage therapists, physiotherapists, and several other colleagues too. We would discuss this, and our chief neurologist, who was a former president of the Swiss Headache Society, Professor Gantenbein, I'm greeting you. He took this topic and he referred to me, listen, we see he gets a lot of questions when he's having a conference and all this stuff. And he asked me, do you see any evidence or what's this all behind? And he requested me, would you like to write a paper about this? And I was like, yeah, if you want, if you're serious, let's do it, right? And that was actually the inspiration. And the Swiss TCM University, I got the team together with Professor Lee, with Professor Furian and other colleagues. We sat together and started to investigate about daith piercing. So this is how everything started.
That's a great story. So you were telling me that before you came to Switzerland, you spent some time in China. You were knowledgeable about Chinese traditional medicine, and you touch upon this in your paper as well about maybe some potential explanations from the Chinese traditional medicine standpoint. Can you just share something interesting from that with us?
Truly, because this is hypothetically, because in Chinese medicine, the kidney manifests on the ear. So, and the ear is connected to the meridians, or you can also say the conduit pathways, and to the Zangfu organs. These are the organs related to Chinese medicine. So, if there is any imbalance in the meridians or in the Zangfu organs, it might have an effect on the ear or on the auricular system. So, and as I mentioned, the kidney manifests on the ear, and the kidney stored essence generates marrow, which consists of the brain, the bone marrow, and the vertebral column. So if the kidney essence will decrease, the production of cerebral marrow will result in pathological conditions, including headaches or disorientations, memory loss. And a possible hypothesis might be if you stimulate the crus of the helix in Chinese medicine in auricular system mapping, this is HX1, I believe, it may help to balance the disharmony between the Zangfu organs and the meridians. This is very hypothetic, but in our paper, we have shown the daith site, which is punctured or pierced in daith piercing. It has no correlationship with the headache zone. The headache zone or pain relieving zones are very else except then on the Daith side. Yeah.
That's fascinating. And I also think it just points to the fact that there's so much we don't know. I mean, as an allopathic physician, I study a lot on that side, but Chinese medicine, there's just so much out there too to learn. So tell us
Yes.
about your paper and, what was your study and what did you find?
Well, basically, our team we got together and we started to investigate, and we all searched the literature, also the CNKI, the China database, and PubMed. We had about 186 hits, and only four were regarding date piercing or headaches. So one was I think I have to have a look. One, we found no prospective clinical trial. One was retrospective study, and three case studies. Still, it was interesting. The patients, they were still on medication after the date piercing. The headache reduced for a certain period of time. Afterwards, it came again. So it was like for us, it is very much placebo. And the social media hype is so huge. If you go to YouTube, you see bloggers, non-professionals, they claim that piercing is the best and it helped them and all this stuff. So from a scientific point of view, we found no evidence at all which supports that piercing for the treatment of migraines or headaches.
So as shared with you before, I'm a clinician. I spent most of my time seeing patients. So next time someone comes in to see me and they bring up the idea of daith piercing, do you feel that this is enough evidence for me to share with them that this is not helpful and not something that we recommend as a part of their migraine management plan, or is there more to the story?
Yes, please do recommend that piercing due to the lack of data, due to scientific evidence, and due to the infection rate and the healing rate, and of course the pain. When I ask the people, they 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 feel a lot of pain during the piercing. And then once it's also very expensive, just pierce the cross of the helix, and they charge about 250 Swiss francs over here. That's what I heard. And like people have reported that the healing process can take up to 1 year, and the infection rate is about 33%. That's quite big. Yeah.
Yeah, so it sounds like
So
there's a
it's
lot of risks without any identifiable benefit at this point.
Yes, yes, yes. And we found no registration on clinical government trials. And yeah, that's why. And besides, of course, our paper might give some answers, and physicians might refer our paper to their patients. But what we saw is our patients, they were not educated enough by professionals, by neurologists or by physicians or people or experts. And they had these rumors, which you can say, or they heard it from a family member or from friends. Someone did it, something helped.
Yeah.
And due to the depression, because maybe sometimes, because migraine is very complex, headache is very, very complex, and due to the depression, and they found no solution, and to find a quick solution, they just said like, okay, I need to do it. I asked one patient, I was like, why are you risking all this pains, and your wound is not healing? She says like, I was so depressed, I was so depressed, and I thought it would help, and at the end it did not help. It just had uh, adverse events for her. And
Absolutely. I mean, I think, it just speaks to the fact that we need better cures for migraine. Absolutely. So thank you for
yes,
taking the time to speak with me today. I really
thank you
appreciate
for
the
inviting me.
conversation. Yes. Thank you.
You're mostly welcome.